All right. So as I mentioned, good evening. For those that are watching this online or afterwards, my name is Rich Bazzillo. I'm NEHA's Executive Director, and we are so excited to welcome you to our virtual and hybrid model of FallFest. This is the first program that we have done like this ever. Last Saturday, we had a great event up in North Conway, New Hampshire at Sermon Farms. So this is part 2 of the event, which is our annual meeting and the Meet the Board webinar. So I am going to get started. If you have questions, we encourage you to put them in the chat. We have our staff here that's going to be monitoring the questions, and we're going to wait to all the questions at the very end. So as you know, with Zoom, you will not interrupt myself or if there's another person speaking if you do have a question. So we will get started. So the overview and landscape. So for those that don't know, NEHA was founded November 1st, 1957. So our anniversary is coming up. For those that were part of our 60-year anniversary, it's hard to believe that 70 years is not too far away. It's only a couple of years from now. We are a chapter of the National Hemophilia Foundation, and we are a member organization of the Hemophilia Federation of America. We have 3 full-time employees and 2 part-time. So over on your right or your left, whichever way your screen is, we have Sarah, who is our program director. We have Brandon, our communications manager. Brandon is shared with the New York City Hemophilia chapter. So it's the only position that's out there where we are sharing both Brandon for 2 organizations. We have Gabby, our development manager, and then myself. And the only one not pictured here, which would have made this a great photo because we don't have any photos of all of us together, is Jill, our operations/office manager. This was at the walk a couple of weeks ago. Our board of directors, who you are going to meet, there are 10 members who are very dedicated, incredible individuals who are going to be speaking in a little bit. So the New England landscape, we have 6 states. I often have to tell my colleagues in other parts of the country that New England is not just Massachusetts. There's 5 other states, and we are proud to represent all of those states. And I want to say them because I think it's really important to make sure that we always have been, and will continue to cover Maine, Vermont, New Hampshire, Massachusetts, Rhode Island, and Connecticut. There are 9 federally funded hemophilia treatment centers. However, there are other treatment centers that may not be federally funded, like Tufts and some others that are part of our network and that we collaborate with. And of course, in the New England landscape, we have the Connecticut Hemophilia Society, which was founded in 2010, and the Hemophilia Alliance of Maine, which was founded in 2011. So our 2021 year in review, when we put this together, none of us knew really what it was going to mean. So what we have here is the virtual programs, and then the in-person/hybrid model programs, and then our upcoming. So you can see our Consumer Medical Symposium. We had 127 attendees, but like FallFest, we had a multifaceted event with a virtual exhibit hall and 3 separate webinars that lasted over various times. So during our exhibit hall, we had over 304 individuals log into that event. Our couples retreat, which was a virtual escape room, we had 48 individuals attend. Family camp, which should actually be in person. We had 153 people attend that, 26 families. Our first connection retreat, which was over 2 different platforms, we had 28 individuals, 16 families attend that. Our advocacy efforts, which is everything from Washington Days to our local efforts to our ambassadors really kicking in, is 81. Teen retreat, which was virtual, we had 13. Our VWD retreat, we had 20 individuals, and our Wednesday webinar chats, miscellaneous cooking classes, everything. And we had about 420 people total that participated into multiple various virtual events. Our in-person event, we were really excited to bring our Hispanic Heritage Month in person. We had 32, but we also wanted to just mention that we did have 13 individuals cancel due to COVID, whether their families got sick. And I think this is something that is going to become a normal occurrence as we move to in-person events, that the health and well-being of our community is the most important. And if we send out COVID guidelines, and even if you have a cold or a temperature, we ask that you don't attend these events. FallFest, which is happening now, we have just over 150 people registered for the event, which again is over 3 parts. Upcoming, our women's retreat is happening in person. Vaccinations are mandated and/or negative PCR tests, and that's coming up on November 19th to the 21st in Chester, Connecticut. We're almost full with that. And then our holiday party, which is coming up on December 5th. So these are what we call our marquee events or our main events that happen throughout the year. So I'll go to the next slide here. Additionally, a more overview. So the New England Bleeding Disorder Advocacy Coalition, which I'll get into in a little bit, otherwise known as NEBDAC, Washington Day Scholarship. Before COVID, we would scholarship individuals to actually attend Washington, D.C. Virtually, it's not really a scholarship because there's no cost of attending, but we had 43 people participate in Washington Days. Our 5th annual winter camp with the Hemophilia Alliance of Maine, we had 56 individuals. We're really hoping, for those that have been to family camp before, that it will be in person in February, but unfortunately none of us had that magic ball to know what February is going to look like. Our Wednesday webinar series, you could see these, our family chats, which go for in-person, which we had at FallFest, to virtual chats, to our Hispanic Heritage, to our First Connections program, and then all the other sessions, cooking classes, paint nights, all of that. We still are hosting our New York City and NEHA family game night. It's the first Friday of every month at 7 o'clock. We do an interactive Kahoots that is continuing. And then in January, this is our 3rd year doing it, we have a New York City and NEHA fitness challenge that we do, where we send Fitbits out, or Fitbit types of materials, and help to encourage healthy living by tracking steps, which is a lot of fun. I just want to give a shout out to our virtual consumer medical symposium. If it wasn't for our partners and our healthcare providers, we couldn't put on this really important event, which is going in its 6th year. So our keynote presenter was Dr. Stacy Croto at the Boston Children's Hospital. And then we had Emily Bisson at Connecticut Children's, Dr. Jeremy Madrid at Dartmouth, Sheila O'Donnell, a nurse practitioner at Maine Med, and Dr. Sally Pells at Rhode Island Hospital. And then, of course, we had our COVID and bleeding disorder talk, part of Consumer Med, Dr. Valentino at the National Hemophilia Foundation. We want Boston to be in there so much because of the Red Sox tonight, which you see down here, which is why it says Boston. Just joking, that's a typo, but we'll just go with it because the Red Sox are playing. Our Judith Crampool postdoctoral research fellowship, the NEHA board, this is the 2nd year, so 2019 and 2020, 2 separate $25,000 contributions we're giving to support this really important research initiative that NHF has. It sends researchers who apply often to the field and helps to support it. This is 100% supported by chapters like NEHA and individuals. Our emergency assistance program, since the pandemic started, we've helped over almost 50 families, totaling $35,000 plus in support. So that's everything for gas, heating, electric. Just had a conversation with the family today that they are struggling. They're going to put a referral in through their HTC for help with their water bill. So these are all the types of things that the emergency assistance program supports. Also, our NEHA store launched, which we were just talking about at FallFest with the fleeces. So many of you asked about that. Our NEHA store, the proceeds support programs like the emergency assistance and family camp, which we will put a link into the chat because there's lots of great things on there. Our First Connections program really is about, in the NEHA Cares program, is when there is a family that is in need in the hospital, we have a system in place where families, newly diagnosed families and/or families with young kids will send little cards through a very grassroots effort to help support our community. I mentioned the fitness challenge, our stretching and joint health. This is October is physical therapy month, and I have to give a shout out to Jeff LeBlanc, who is one of our award winners. He helped to put us together last year. We filmed it, but there's going to be a 3-part stretching and joint health video series. Jeff has hemophilia himself and dedicated his time, so you'll be seeing that before the end of the month. And then our Giving Tuesday. So for the past 4 years, instead of asking for donations for NEHA for Giving Tuesday, we have picked a charity. We have picked HFA's hurricane relief support after Hurricane Maria in Puerto Rico. We've done Save One Life to camps in the developing world. And last year, we picked the World Federation of Hemophilia and made a donation of just shy of $4,600, which was by you, to give to other nonprofits that are supporting the cause to support bleeding disorders. I also want to mention our scholarship program. So this will be our third year of our John Cavagna Adult Scholarship Program. So this year we had two $3,000 winners. We had Matt Paradiso and Rich Adeo, one from Mass and one from Connecticut. This is for the non-traditional student returning back to school. So, and applications will be open for the 2022-2023 in January. Again, mentioned Washington Days. I put the asterisk here because the NHF and HFA travel scholarships, we usually award those for the national conferences, but both national conferences are virtual this year. Our 100 for 100 mile program, which is part of our membership, which I will talk about, we are offering that for FallFest, and we are offering that for our Hispanic Heritage Symposium. But the gift cards that we've given out in boxes, so all the boxes that we've done over the past year, the cooking classes, the help with breakfast, paint nights, all of these things, we've given over $230 gift cards to help give you an enhanced experience through part of this program, which we know food brings people together. Many of us are sitting at our dining room tables, and we want to, be able to showcase that service to our community. Our fundraisers. We have continued our Bloody Mary extravaganza. It was virtual for the past 2 years. We are hoping it could be back in person next year. I will say some of the bars here in Providence no longer exist, sadly, because of COVID, but we are going to do whatever we can to bring that back in person. The Falmouth Road Race, this is our third year with the Falmouth Road Race. It was our first year partnering with Save on Life for a Wheels for the World in-person bike ride. Mentioned the Neha store. We had a red tie soiree silent auction, which went last year, which we were hoping to do the red tie this year, but it will be next year, May 14th. Does anyone else feel like you just go crazy when you think about the last 2 years, when you're like, this was supposed to happen then, but now it's here and now it's going on? So just bear with me as we go through all these dates, which is supposed to happen 2 years ago. Our golf tournament raffle, and then something new that our development committee really pushed for, which has been great, our community-driven fundraising events, which is now live on our website, and you'll see a program one about that for next year. We started our healthcare provider monthly calls, our monthly call with social workers based upon feedback, and we did a needs assessment for them too, which we learned a lot. This is our 5th year with our Boston University graduate intern program in genetics counseling. You could see them. This is Julia. It's her, hey Julia, if you're on here tonight. Julia's last day with us will be on Friday, but she's done an incredible job. And this year, Julia was able to get almost all of her class from the Boston University Genetics Counseling Program to the walk to help us out, which was awesome. So these are all genetic counseling students at BU that helped us out at the walk this year. It's our 3rd year partnering with Brandywine, Laura, and Fu Tam. For 3 years, have been speaking with that genetics counseling class, similar to the Boston University, just about hemophilia and how it's a genetic event. So it really makes for a lot of these students it to be personal. Our improved partnership with Save on Life, the World Federation, Hole in the Wall, Tito's sponsors our Bloody Mary competition. Mint It, we have that again for the holiday season. You can order your cards, and our proceeds support NEHA and then HAM and CHS. Again, if you have any questions, please put them in the chat itself. The Patients for Prescription Access Coalition, which NEHA chairs, this is just a sample of the 25 plus organizations that are part of it. We have a bi-weekly call every Tuesday at 11 a.m. And we're really excited that this group was able to pull together and pass, with many joint letters and many work, a ban on accumulator adjustment in the state of Connecticut, which was incredible. Also, there was 2 bills that were introduced in Rhode Island. Unfortunately, they did not pass the committee, which is absolutely normal. It's very unlikely that sometimes bills for the first time will pass. So those will be reintroduced next year. And in Massachusetts, the bills had a hearing in the Senate and the House. And because it's a 2-year legislative process, we're kind of waiting on next steps and strategizing behind the scenes about that as well. I just want to give a shout out on the structure of the New England Bleeding Disorder Advocacy Coalition. It was founded in 2016. NEHA is the driving force and fiscal agent of it, but we work with our partners, the Connecticut Hemophilia Society and the Hemophilia Alliance of Maine. Then we have 2 state leads per every state. We just had our call on Monday. It's the 3rd Monday of every month at 8 o'clock. And then the ambassadors is kind of our army or the Marines that when we press the button, we know when the ambassadors can help us because those personal stories make a difference. This is just a list of the awards over the past couple of years. I just want to give a shout out to the 2021, especially to Sarah Shinkman, our program director, because out of all the camps in the country, we were picked as for the National Hemophilia Foundation Val Bias and Todd Smith Innovation Camp Award, which was for our virtual camp of last year. So in addition to receiving a beautiful award in the office, we also received $5,000 from NHF to camp. So Sarah, amazing job putting that together and well-deserved as leading again for innovation, especially during the pandemic. COVID resource page continues to be updated. Our board will talk about this, but you hopefully saw the email today announcing the great work of the mental health task force, which many of the board members are on and staff and others. Emails, we do a monthly NEBDAC, supposed to be have your coffee with Joe type of message, the first Friday of every month. As a recap of advocacy news, our newsletter, we've been trying to do more postcards, website platforms, social media engagement. So I told Nancy I was going to stick to 30 minutes. So I'm going to go through the next, because for many that know me, and I know many others like numbers, this is a graph of where we are Facebook followers. Thankfully, our Facebook followers continue to increase. We're not decreasing, so that's a good sign. You can see here from 2014 up until 2021 where we are. But as we know, likes are just a like. You know, anyone can like anyone. It's the engagement that we look at. So this is the Facebook algorithm of the number of shares that happen on our page, the number of exposures. We know that when you like something and share it, you are helping to advocate to your own network as well. So a lot of this really comes from when we have events like Bloody Mary where we promote them. It really does. I mean, almost 90% of our tickets are sold on social media for the event, which has sold out when it's in person. This is just a snapshot of some of the articles that we had in the news this year. So we had a couple of shout outs for our Bloody Mary competition. We wrote a couple of op-eds. This one was in the Connecticut Mirror about lawmakers should restrict copay accumulators. We just had an article in the Conway Daily Suns about FallFest. There was a pretty big spread. I saw it in person about that as well. So this is the part where we're going to give an annual financial update. We're going to review revenue and expenses, the value of membership, et cetera. And then we're going to go into our strategic plan. So when we look at where we are, I just want to put an asterisk about 2020 and 2021. We are almost done with our audit. I know, Bill, we're getting there. But the officially, the 2020 numbers are not audited yet. Those will be done November 15th. So again, like COVID, you have to kind of think back to last year, which is what we're going to base the numbers on. But this in a nutshell is where we ended last year. So you can see there was a big increase from 2016, and we've been hovering right around the $1.1, $1.2 million mark. And even through COVID, our community, you continue to believe in NEHA. And you'll see the walk numbers, you know, continue to be not only the largest walk in the country, but the amount of work and effort that goes into it. And you'll see why the walk is so important of the percentage that it takes up of our revenue that comes into the organization. So the fiscal year 2021, this is where we are as of this moment today. So when I go down the breakthrough, you can see here that the walk really does make up a big chunk of what comes into the organization. We then have the programs. So that's the support that we get from the exhibit booths and donations. Our golf as well. Our golf actually increased quite a bit this year, thanks a lot to Dot Sparrow and her family and the hard work that went behind the scenes with that. But you can see overall, when we look at what comes into the organization, the walk is almost half of our budget. So this is really important that the walk, our Unite for Bleeding Disorder walk, continues to be a hallmark of the organization as we look forward. So I'm going to just advance this slide again. You can see that 2019, the walk had a record-breaking year. It was the most amount of funds ever raised in the history of the walk program nationally. I don't think our friends from New York City will be on here, but I'm sorry. For those that know that we had that competition going along with them for many, many years. 2020, what we expected, there was going to be a drop with the virtual programming. And we also heard too that many of the team captains, last year didn't feel comfortable asking for donations, but this year we did see an increase. So we're back over 300,000 again for the walk program itself. So when we look at industry versus non-industry, we like to look at this, and you can see that the majority of the walk, especially from 2017 on, is the majority, 70% is individual donations, the $50, the $100, the local businesses. So we are so thankful for our support of our pharmaceutical companies and our specialty pharmacy. You certainly help us to reach our goal, but I wanted to focus on that orange line because it's the individual donations, the hard work of the team captains that get us to the amount itself, where you see the $244,000 plus. And I think this is really a testament to our Wicked Strong family that a lot of walks across the country are not this way. The graphs look very different. And this is a true, again, testament to you and your hard work. This is a breakdown of our expenses. A lot of our expenses go to support our education. This is what our auditors will put together for 2020. So this may shift a little bit once they're done with our numbers. But the majority, we know education, support, and advocacy is our three main pillars of what we do here at NEHA. And you can see education primarily is where your dollars and where the revenue that comes into the organization go to. We try to keep our fundraising and our administrative costs low, and then you can see advocacy and support. But clearly the yellow box demonstrates education really is where we are spending the majority of our expenses here. This is something based upon where we're at. So this shifts a little bit, and we want to make sure once our 2020 numbers are complete, this may shift a little bit more, but we do see industry versus non-industry, and we expected this with the pandemic to change a little bit. So it did change slightly in terms of what comes in from individuals. And just for those that are on here, when I say non-industry, that's individual support, outside grants that are not from the pharmaceutical industry or specialty pharmacy, and then our industry partners, which we so appreciate, is our partnerships with many of them. So this is something that we are trying to track, and just to make sure that we are following what is industry versus non-industry. This is our membership. We went back to 2017 and 2021. Our 2021 membership jumped up quite a bit. And I think what's interesting about this is our households jumped up as well, but the average membership over here is something that it's the highest that we've had since 2017. So what that means, and I'll get into it a little bit more, as a membership-based organization, the membership goes from a $25 individual all the way to a $50, and it goes up to $1,000, which different levels give different aspects and benefits. But this is incredible to see that the membership drive really does make a difference. And I will say, for those that have already done it, you're ahead of us. We've had a handful of memberships for 2022 come in already. We haven't even launched it yet. So that's great that we have seen them come in. Technically, our membership drive starts around FallFest and goes to FallFest the following year. And if you ever have any questions about membership, you could always reach out and we can run the report for you. But I just want to thank, part of the membership is the induction into the Charles Doherty Giving Circle. And this is part of the membership drive, that if you give $1,000, you will be inducted. If we had the Red Tie Soiree or FallFest, we usually have a donor reception, we would induct you in there. Unfortunately, this year it will be virtual, so you will be receiving a little package in the mail from us before the end of the year. But I just want to thank all of these individuals and organizations that give at the highest level, which is the platinum level. And I would not be doing this justice if I just leave the names on the screen. So I'm going to read them out loud. So our platinum levels: Bill Sogu, the Boston Hemophilia Center, the Dedham Savings Bank, Kate and Jordan Bazinski, Lori Kelly and Doug Mildrum, Lori Smith, the Maine Medical Health Center, Margaret Hudlin, Mary Jane Rasucci, Michael Corinne, Missy and Alan Kennel, Nancy and Darren Messina, and Vanny and Michael Rudishan. Thank you very much for the support that you give at the $1,000 level. And our gold level, which also gets inducted into the Giving Circle itself, we have Andrew Loyne, Laura Gluffling Tam and Fu Tam, Jane Kavanaugh Smith and Chris Smith, Joanne Brine, my parents, which I thank you, Marie and Richard Pizzillo Sr., Megan and David Carty, Patricia and Robert Quadros, Patricia Bachman and William McCartney, and Yvonne Lotz. Thank you so much for the support. Of course, all memberships make a difference. We would not be able to get at that amount. And what is not on here too is almost 100% of all memberships are made from individuals. So this is all individual support. And when you look at membership, you may ask, and I hope this is the case next year. We did hear Washington Days will be virtual, so NHF is not having Washington Days in person, that will be virtual. But the membership gives you access to travel assistance to Washington Days, NHF, HFA, free registration. There's a discount at family camp. We try to do some early registration for the events that sell out. The FallFest and medical symposiums, $100 for 100 miles. The Giving Circle. And this year, you're the first to hear, thanks to the hard work of our development committee, you're going to get a woolen hat. So if you don't have enough of swag already, you're going to have a beanie that you could put on and wear in the winter. Also, I just wanted to mention that we never want a financial barrier to stop anyone from becoming a member. Our way of looking at membership is the involved individuals. We know we have about 270 households that are involved, which is about 1,200 people, including kids. That does not include what's on our mailing list. These are active members of the community. So if you know someone, or if you yourself can't afford that membership fee, please do not feel embarrassed at all. There's a form on our website that says, I would like to request a scholarship. It goes right there. You get a letter in the mail and everything goes accordingly. So we never want the dollar sign to stop you from doing that. The same thing with family camp, the same thing with pretty much any of our programs where there's a cost associated with it ourselves. Also on here, we usually give a discount for the Red Tie Soiree as well, which we will be hearing about also. But with that said, I just want to say thank you. I went through a lot in about a short amount of time. And Nancy, I'm only 2 minutes overdue, which I think is pretty good there. But if you have any questions, please reach out to myself or one of our dedicated staff members. We are here for you and to help you, guide you through anything that we can. And I need to give a shout out. It's not on here, but he completely blew me away. Brandon Green, our communications manager, was able to get our 2022 dates up on the website. So we'll put that in the chat. The ones that are solidified that we know are definitely happening, things like the walk, things like camp, Consumer Med and FallFest, those are, and the Red Tie Soiree. If you don't see something on there, that doesn't mean it's not happening. We're just playing the game of where does the contract still live for 2019 and where can we find space given that everyone else is having conferences now. So I think where Sherman Farm did it is it helped us think outside the box that maybe we don't have to hold events at conferences or hotels anymore. We can do things outside and re-event things, which is definitely a silver lining of COVID. So with that said, Nancy, I'm going to stop sharing my screen and turn it over to you.
Guess that means I have to unmute. You're a hard act to follow, Rich. You talk so quickly, and we're going to go from the quick Rhode Island accent to the slow Southern accent. So thank you. I'm going to share my screen. I'm Nancy Messina. I'm the chair of the board of directors of NEHA. And for those of you who I don't know, been involved with NEHA for many years. I have 3 boys, and my youngest of 3 has severe hemophilia A. And we have benefited from a lot of people on this chat tonight and a lot of the work that NEHA has done over the years. So very grateful to be here and glad you guys are all, you put us on a split screen with the Red Sox, I assume. So thank you for joining us. Let me see if I can pull this up. Did that work? I believe it did. Excellent. Great. So Rich, and again, thanks to you guys. I mean, you and the staff are just amazing. You make such a great team. I can't imagine what we would have done through this extra long pandemic without you guys and all your creativity and flexibility. And you've really done an amazing job. So definitely a shout out to the staff and the team. But the board's had a busy year. I'm gonna put up the 2021 board members. We've had some turnover, which is actually really healthy for a nonprofit board. We've had 3 members roll off: Alan Hurley, Peg Gary, and Janice York. I think Peg's on the call. Shout out to Peg, who helped us put together this. She was there at the beginning of this strategic plan that we're going to produce, that we're going to introduce to you tonight. So, but we've also added 4 new board members since last year's Meet the Board session. So we have 10 members in total now, and we've added Carolyn Miazga, who's on the call tonight, is our new secretary, Mike Dowling, Erica Reeves, who I'm not sure has made it. She was up in Maine and didn't have a good signal, so we're hoping that she can join us, but I don't see her yet. And then finally, over the summer, we were lucky enough to have Dr. Kathy Rosenfield join our board. It's the second time she's been on the NEHA board, and she has retired from Tufts Medical Center, and we are really lucky and happy to have her join us as well. So, so we plan to make this a yearly application process going forward. So stay tuned, because I think we'll be accepting new applications again this year, starting on November 8th, and there'll be a period until mid-December or so where we'll be accepting new applications. So the goal will be, once the applications are submitted, the board's governance and nominating committee will vet them, and hopefully we'll bring on any new members by the beginning of March. Let's see if I can advance the slide. There we go. So the board's primary task this year was to complete the 5-year strategic plan. It's been a very long time since NEHA's had a strategic plan, and so you could see from Rich's slides that we had an explosion of growth over the last 5 years. So we really needed a good, solid plan going forward. So the process was led by the board, but we had extensive staff input. We were communicating completely over emails, Zooms, and Google spreadsheets, because we didn't want to meet in person. It was really challenging. But I just want to say thank you to all of the different expertise that the board members brought to the table for the process. But extra thanks go out to Kate Bazinski. Kate really took the lead on all of the Google Docs and spreadsheets, and she taught me all kinds of new things about process and strat plans that they did not teach me in architecture school. So that was really important to keeping the process going and getting it done in 10 months. So, but during the 10-month process, we relied primarily on the input that we had gotten from the 3 needs assessment surveys that we did back in 2019. We had a NEHA community needs assessment survey. We also surveyed the industry partners and the HTC social workers. So that was a lot of the data that we used and feedback from the community. But we ended up with a really thorough strategic plan. I think it's not perfect, I'm sure, but it includes a revised mission statement. We adopted a new vision statement, and we also defined 8 new core values. We also adopted a new diversity, equity, and inclusion statement, which I think either Mike Rudishan or Erica will talk about in a few minutes. But all of this was part of our 5-year strategic plan, and ideally we're going to be accomplishing these goals between 2021 and 2026. And we defined 8 strategic priorities, and each of them had many action items associated with them. And unfortunately, we don't have time to go through all of them tonight, but we'll give you an overview with this summary. So So let me start with the revised mission statement. We updated it. Mission statements describe an organization's objectives and its approach to reach those objectives. So we have them both up on the screen for comparison, but the updated version is a little bit longer, but we thought it was a little bit more thorough of a description of our objectives. So we updated it to read, to create an inclusive community across all 6 New England states that empowers and enhances the lives of individuals with inherited bleeding disorders and their families through education, support, and advocacy. And those 3 words, the 3 pillars, education, support, and advocacy, are obviously the key words there. So we also added new to NEHA, we have a vision statement. And this is just designed to describe the desired outcome of an organization and what we want to achieve in the future. So we thought a succinct kind of short way to describe our ideal outcome would be to improve the quality of life and health outcomes of the New England inherited bleeding disorders community. So short and to the point. There we go. And so also new to NEHA were some core values. Core values are typically included. They drive an organization's priorities, commitments, and decisions. And the idea is that these 8 core values will guide our behaviors, our judgments, and how we go about accomplishing our mission. So adaptability, collaboration, community, compassion, diversity, empowerment, excellence, and integrity. So we wrote a few sentences for each of these describing how we see these values relating back to our mission. But I think I didn't want to go on there. That would take too long. And so I'll let you go to our website to find the strategic plan if you want to see more about how, what our thoughts were on these 8 core values. So in order to get to know you, we have these 8 strategic priorities, and the board members, we have a number of them on the call tonight. So we thought we'd have each person speak, tell you a little bit about themselves, and we'll go through these 8 strategic priorities fairly quickly, but enough that maybe will pique your interest and you'll go onto the website and look for the strat plan and read more. But I'm going to start with our new board secretary, Carolyn Miazga, and she'll start with priority number 1, and then she can pass it off to Mike Rudishan, and we can go from there. So Carolyn, I'm going to turn it over to you. You might need to unmute. There you go.
Yes, all set. Thank you so much, Nancy. So my name is Carolyn Miazga, and as Nancy said, I am new to the board this year. I have 2 sons with severe hemophilia A. Aiden is 9 and Andrew is 5. And I've been a member of NEHA for a number of years, and it's been an incredible organization to help my family navigate. So that being said, the first priority that I'd like to share is enhancing access to NEHA programs and services across the entire New England region. So as Rich mentioned earlier, NEHA serves all 6 New England states. And again, important to note that these include Vermont, Maine, New Hampshire, Massachusetts, Rhode Island, and Connecticut. And our goal is to hold events in all 6 of these states to better serve the community, regardless of where they live or receive medical care. Additionally, we want to be able to hold virtual events for people who are not able to attend in person, whether that is based on location or whatever the circumstance. And finally, for our marquee events that Rich also described earlier, we would like to be able to provide a virtual option, again, for those who may not be able to attend in-person events. Moving on to our chapters. So in New England, we do have 3 chapters that exist to serve the New England bleeding disorders community. And to serve the community best, we will be optimizing NEHA's strategic partner relationship with both HAM and CHS. And this is in order to reduce costs and redundancy and respond to your feedback. Lastly, I just wanted to mention that I am actually organizing the formation of a new board advisory council. And this is to gather community ideas and feedback to help shape the future of our current and new programs and events. So please stay tuned for email that will allow you to register to become a member and join our first meeting to be held in November. And I believe now I'm going to be passing on to Mike Rudershan.
Indeed. Thanks, Carolyn. Hope everybody can hear me okay. Yeah, my name's Mike Rudershan, and I've been benefiting from the NEHA community for honestly as long as I can remember. Used to go to family camp back when it was up in Maine, and then was a counselor for a number of years. And now it's just been an absolute privilege and an honor to be a part of this board for the last couple of years. So I'm going to talk to you today about some of our diversity, equity, and inclusion goals. Nancy, was this the first slide or is there one before it? Yeah. Yeah, I'm going to talk a little bit about sort of some of our goals around, like I said, diversity, equity, and inclusion as it relates to the NEHA community. And before I get into the goals, I just want to state, and I'm sure many of you sort of read this as it came out in our newsletter a number of months ago, but over this past year, we have launched a diversity, equity, and inclusion task force similar to our mental health task force to help address some of the needs of our community, and that consists of a number of board members as well as other community members, and that has been an amazing group to work with. So just quickly, some of the goals we have within diversity, equity, inclusion, and amongst the task force are first to ensure that the NEHA leadership reflects the diversity of the inherited bleeding disorders community in all the New England states. And in order to address and achieve this, we're truly hoping, that we can sort of engage, new board members, or as we're considering hiring new staff members or contractors, that we're considering diversity within those positions, such that the composition is aligned with our membership composition. And then secondly, what we're really hoping to do, and what the task force is diving into as we speak, is to try and identify, engage, and then ultimately connect historically underrepresented and underserved individuals with inherited bleeding disorders, and those in their networks, such as family members, to our community's education, advocacy, and support programming across the 6 New England states. This is something that's extremely important to all of us. And again, this is something that the Diversity, Equity, Inclusion Task Force is working on now. And as we continue to work through this, we will be hopefully presenting on some things in the not too distant future. So if you move on to the next slide, Nancy, as Nancy mentioned in her introductory slides, this year we actually crafted a diversity, equity, and inclusion statement, and this came a little bit from the Centers for Disease Control declaring that racism is a serious public health threat, as well as learning about how other nonprofit groups work through DEI statements and issues. And so I just wanted to read the statement for you here, so that we've all sort of seen it, and then we can certainly chat about it either within questions or at a later time. But the statement reads that NEHA stands with the Centers for Disease Control and Prevention in declaring racism as a serious public health threat and denounces all forms of discrimination and intolerance. Recognizing that taking a stand is not enough, we are on a path of exploration and community engagement to ensure that the core values of diversity, equity, and inclusion are reflected in all NEHA policies, practices, and programs. We believe that this is the best way to serve everyone in the inheritable bleeding disorders community, including families and caregivers throughout New England. We strive to be an organization that seeks equity and works to improve the health outcomes of all people, regardless of bleeding disorder diagnosis, health status, disability status, age, race, ethnicity, color, country of origin, immigration status, primary language, religious or spiritual belief, sex, sexual orientation, gender identity or expression, socioeconomic status, veteran status, or place of residence. So I think now I'm going to kick it over to Bill, and he's going to talk a little bit about our finance goals.
Okay, thank you, Michael. My name is Bill McCartney. I'm the board member and treasurer of NEHA, and I help Rich managed the organization from a financial standpoint. But I'm very happy to report that NIHA is a financially viable and stable organization. We have successfully survived the pandemic, unlike many organizations out there that have really struggled and gone out of business and so on because of the pandemic. Excuse me. But Rich and the board, we remain committed to being financially viable over this 5-year period of our strat plan. And this will allow us to continue to expand and offer all of our programming, even if we have additional tough times out there in the environment. And that's why the board, made this one of the major bullet points when we did our 5-year plan, is to keep ourselves focused on financial viability, financial health. But when we look at it, how are we going to do that? What are the major things? So we have a series of sub goals inside of that financial viability goal itself. Just to quickly mention a couple, we're going to maintain our existing fundraising efforts of the golf, excuse me, the golf and the walk and whatnot. But we also want to expand some of our fundraising activities. So we want to see more member fundraising over the 5-year period. And NIHA and the staff is going to help our members to do that with providing support, websites, portals. We can host some of these activities. And we're going to be working with the community on suggestions and providing feedback and whatnot. We've also just recently initiated what we call a legacy or a planned giving fundraising opportunity. And this is where families can put NIHA into their estate planning or their wills. There is some information that we've recently put on the website on sort of a how to do this. So, we would appreciate if everyone would take a look at that when you have a chance, because this is a great opportunity for NIHA. And we're going to be working with the folks here to expand with this idea, to expand the communication of this, the advertising of it, as well as doing, annual appreciation dinners and so on. So that's an opportunity that we've just kicked off that we're kind of excited about. That should provide some opportunity. And even though we're going to do some member fundraising, we're not letting the board off the hook. We want to see the board do more board-led fundraising. So we're going to be setting up some processes, if you will, to look at the participation, the effectiveness, and to try to do this with minimal support from the NIHA staff. An additional idea that we kicked around and as part of our 5-year plan is to put some additional fundraising, additional resources into our fundraising. So this might include using the use of consultants and or maybe hiring a full-time grant writer. We're also looking at kicking off a program, which we haven't done yet. This is still in the idea stage, but looking at in-kind donations. So we're going to look at that. Would people be willing to donate property and so on? So that's an idea that's just in its infancy, and we're going to be looking at that. So with that, I'd like to hand it back to Mike for his continued education for our plan here. Thanks, Mike.
Thanks, Bill. Yeah, me again. I'll spare y'all a second introduction, but I am excited to talk to you about our sort of communication goals over the next few years. So, specifically, our goal here is to communicate effectively to enhance the trust within the community and with our key stakeholders. And the first goal here is to work to deepen the relationships and build trust both within our community as well as with key stakeholders essential to our mission. And these stakeholders include HTCs, independent hematology practices, industry partners, both national bleeding disorder organizations, as well as other bleeding disorder chapters, both near and far. And we're hoping to achieve this through effective collaboration with our stakeholders to help fulfill our mission. As Bill mentioned on the previous slide, not letting the board off the hook here, we're also working to strengthen and enhance the board's presence within the community. We want to make sure that the board is at least some board members are present at different events and that they have speaking engagements, so that we're available for folks to chat with at most events. And so secondly, we're working working to optimize NEHA's communication strategy to enhance our presence with our constituents. So we're hoping to achieve this through enhancing our engagement on social media, maintaining and updating our website regularly to provide the community with both accurate and timely information, and also by continuing to publish our quarterly newsletter to highlight, our community stories, the different medical news that we think is pertinent, highlighting the events we've had, and all the other great things that we include in that newsletter. So hopefully that gives you a quick overview on some of our communication goals. And I think I'm kicking it over to Kate.
Here we go. If I can find the mute button, right? Thank you, Mike. So I'm Kate Kaczynski, and I have two children, Nora, who's 7, and Colin, who's 5, and Colin has severe hemophilia A. And I have been sitting on the board for the past 3 years now. I get to talk about our programming, and it's really a privilege to do so, because one of the consistent themes across all of the feedback we received in the needs assessment process was that our community just loves the programming. And so kudos to our amazing staff for all the work they do to bring our award-winning programming to you all. It really is phenomenal. And we want to make sure that over the next 5 years, we continue to maintain this quality and excellence that you all have come to expect. And so as we try new things with COVID, like we always do, the staff is so great about collecting feedback. And so we will continue to review all the feedback and integrate the lessons learned, so that we really ensure that all the programs we offer over the next 5 years are of excellent quality and of high value to the community. And it's also really important that all of our event offerings really meet the needs of all of our constituencies. So we want to be a little more strategic in the view of our calendar to make sure that we are making sure that we're providing events that that cut across all the constituency groups, so that it's not like we offer 17 events in a row for hemo moms, which I would love, by the way, but and then like nothing for blood brothers. So really making sure that we have that holistic view, and looking to the board advisory council that Carolyn talked about earlier to make sure that we're meeting all of those various needs. And the other thing that we heard very clearly in the needs assessment was that everyone wants more events, and more events for like niche programs and local events and small events. And so we would love to be able to do all of those things, but we're going to burn out the staff if the staff are at every single teeny tiny event. So what we have, what we're envisioning for the next 5 years is a community-driven events program, so that any community member who has a fantastic idea for an event for their constituent group in a local community can apply to NEHA for funding and get that event supported by NEHA, so that we can meet more of those smaller needs without necessarily having staff attend each and every one. The other thing, the final thing that I think is really important to mention was that in the needs assessment, we heard that this community is really struggling with mental health. We heard that loud and clear, that we really need to be doing more to talk about mental health and to support the mental health needs of the community. So we, as the board, have created a new mental health task force that Mike Rittershan and Nancy and I all sit on with a number of other folks. And we are working to create and bring more mental health sessions into existing programs, and to really start the conversation around mental health and continue the conversation about mental health to reduce stigma. And Brandon beat me to the punchline as all this, and as one of the first initiatives of the Mental Health Task Force, we have created a new section on the NEHA website, the Mental Health Resource Hub, as Brandon termed it. And so you can go on the website and see all of the resources that we have available that we've collected there to help support this community in the mental health needs. So I think, yes, thank you, Brandon. So I think I'm turning it over to John Wells to talk about support.
Great, thank you, Kate. My name is John Wells. I have been on the board since March of 2020, so about a year and a half now. In addition to being on the board, I sort of moonlight or double as the board attorney. And particularly during COVID, my primary responsibility, I think, for the board, Nancy can attest, is assessing risk and figuring out what we can do and can't do. So if you've signed a waiver or a contract with NEHA recently and you've agreed to waive your, you have the risk of death or serious injury, that probably came from my computer. So I want to talk this evening about the next priority is continue to enhance the support services available to the community. Support is obviously a pillar of what we do. It's in the mission statement. And we're extremely fortunate to have an amazing support network and support programs. Rich mentioned some of these in his introductory remarks. The Emergency Assistance Program with more than $35,000 given out, care packages, travel scholarships, academic and educational scholarships, medical IDs, and other support programs. In addition, we have the NEHA Cares initiative, which you can read about more on the website. It's an initiative designed to connect bleeding disorders families in a meaningful and discreet way in times of need or change in circumstances. And it's a program run entirely by volunteers from the community. And the NEHA Cares team prepares personalized notes, cards, or care packages to brighten the day of some of our youngest community members and their families who are going through tough and difficult times. And these can consist of a handwritten letter, friendship bracelets, drawings, or other crafty mementos. So these are all some of the most important things that we do as an organization. And so our priorities going forward are to make sure that we have appropriate staffing for all of these programs and activities. We ask a lot of our staff, and so we need to make sure that we have the ability to cover everything that we want to do from a support standpoint. And more importantly, engagement with the community. We want to increase the engagement of the beneficiaries, particularly of the NEHA Cares program, make sure that everyone knows about it. And we want to create a mechanism for organizing and evaluating data and communication with applicants to assess engagement and grow memberships. It's great that we have a wonderful support network and support programs, but they're not valuable unless we make them available and staff them well, and that the community most particularly knows about them and what's available. So the priority here is to make sure that we have appropriate staffing and engagement so that we can continue to offer the support that's so fundamental to the mission. So with that, I think I'm handing it over to Mike Dowling. Mike, are you ready?
Hi, my name is Mike Dowling. I'm from Vermont. I have severe factor VIII or hemophilia A, and I joined the board earlier this year. It's been a great opportunity to get to kind of know the community greater at large. NEHA has played an important part of my life here for 60 plus years, so certainly I'm very familiar with the organization, and I kind of began a few years ago working with Advocacy. So I was asked to come on as a representative for Vermont. We have a team of people. We have state leads that basically are in charge of taking a look at all the different legislative needs of things that might be coming up for different bills and things in front of the State House and so forth. But I can go down through our slide here a little bit. We're tasked with expanding and defining and determining staffing for advocacy initiatives. We have a part-time staffer, Joe Zamboni, that's dedicated to our needs here. And then we're trying to deepen relationships with state, federal, and local elected officials. So we do not only Washington days that you might be familiar with, but we're also doing state days if possible. And we're also trying to get state proclamations or resolutions for March's Bleeding Disorder Month. And so that's an initiative. Oftentimes there'll be some kind of a signing or something. There might be a little bit of a public ceremony, trying to get information out to local news media, just to try to bring attention to the general community, to get to know that we're out there and that there are needs here for the bleeding disorders community. We also collaborate with many national organizations and other patient advocacy groups to get things done, and certainly work with HAM and work with Connecticut. We also work with the Hemophilia Federation and NEHA on a national scale to look at possible bills and things that might be coming up on a federal level. And we're just trying to collaborate with all different kinds of groups to get things done. We collaborated recently with a whole bunch of groups in Connecticut with 21 other groups to help a bill get passed down there for Connecticut Bill 1003 that Rich mentioned earlier, that basically will help protect us from co-pays and things like that. So we have lots of different efforts. Even last night, I was in on a drug utilization review board meeting here in Vermont that basically was taking a look at what hemophilia products the state would approve through their Medicare program. So there are lots of different initiatives out there of things that we're trying to do for the greater good here, and looking out at funding issues or availability of product, things like that. So anyway, we're always looking for new members, and we have a great team of state leads. Some of them I think are on the call tonight here, and it's been a lot of fun to work with them, and it's also great to be on the board. Thank you. I'll hand it back. I think, I'm not sure who's next. I think it might be going back to Nancy.
No, actually, Mike, it's coming to me. This is Kathy Rosenfield. Yep,
oh,
my
thank
turn.
you. Sorry, Kathy.
Thank you.
I'm Kathy Rosenfield. I'm a pediatric hematologist oncologist, and I worked at Tufts Children's Hospital for over 30 years. And I had the privilege of taking care of many children with hemophilia and other bleeding disorders. And now I have the privilege of being on the board. So I've been asked to talk about the last but not least goal in the strategic plan, and that's the growth and the retainment of the staff at NEHA. They work exceedingly hard, as you've heard, producing really award-winning programs, and we need to find ways to retain them to the greatest extent possible, whether that involves professional opportunities or hiring new members to join the staff. We also need to monitor how engaged they are and how happy they are with the positions that they have. There's a focus on long-term sustainability and continuing to meet the diverse needs of the community without creating unreasonable expectations, basically making sure that there's a work-life balance for the staff, because all of the programs that the community enjoys requires a lot of effort, a lot of time, and many hours during the day, the nights and the weekends. Part of that hopefully will include engaging more volunteers from the community to work with the NEHA staff, and that might roll over into structuring more volunteer programs, specifically one that includes team leaders. And lastly, building on the committee structures that already exist, such as the programming services and NEBEC, but also pulling new programming that's being developed in terms of NEHA Cares and the Programming Services Committee, the Advocacy Council, and Advisory Council. I think we can all agree that the NEHA staff is exceptional, and we would all like to do whatever we can to retain them for the longest period of time possible. I'm going to now pass this over to Nancy.
Thank you, Kathy. You can tell you've been on the board before. You just jumped right in with all that. Great job. Thank you. So it is let's see, I'm going to go, I think that's it. That's all 8 strategic priorities, and it's pretty ambitious strategic plan to do in 5 years, but what we'll be doing is breaking it down into annual action plans. So we'll have targeted objectives and specific measures of success that we will track towards all these various priorities and goals. So we've, we mentioned we've already taken some steps to address some of the more urgent priorities, like the mental health task force and the diversity, equity, and inclusion task force. But our plan is for the board and the staff to assess progress at multiple points throughout the year. And then we'll report back on any progress that we make every year at this annual meeting. So this will be a good time for us to take stock and let you know how we do. So I think we're going to be really busy. I'm really grateful. Great job to the board. We didn't even run over that much. But I just want to reiterate that if you want to read the full, actually the official plan that we adopted, if you go onto the NEHA website in the About Us tab, there's a red box that says strategic plan. Or as always, you can email any questions or comments to the board by our board email, which is board@nehemophilia.org. So thank you. And I'm going to pass it back to Rich. I think he's got a few more things, and then we'll take some questions. So thank you to the board for speaking up. Thanks.
Great. Thank you, Nancy. Before I move your spotlight, I need to say thank you to you. Your leadership over the past several years has been something that often goes not overlooked by many, but the amount of time that you put into this organization. And the board, for those that don't know, it's volunteer. Every single board member is volunteering. And as I'm listening to each person speak, we are so lucky to have such a dedicated individual staff. I'm on a lot of national calls with my colleagues across the country, and it's not this case. So thank you, Nancy, and to every single board member for what you do for the organization and believing in it. So thank you. With that said, I'm just gonna, if you have questions, please put them in the chat. This is the time where it's a Q&A. There is no silly question. Everything is on the table. As we have always said, we want to be transparent and accountable. We are a nonprofit, a 501c3, almost for the past 65 years. And being a nonprofit is we are accountable to you and to ourselves. So if you are not comfortable asking the question tonight, you can always reach out to us as well. I do want to mention too, I know that as the board went through certain things, there were a couple of names that were mentioned. NEHA does have 3 full-time staff, 2 part-time, but we also have subcontractors. Subcontractors help us behind the scenes, that they're not employees of the organization, but they make a tremendous difference of helping to carry the weight of some organizations. I just talked to a relatively new individual to the community, and they're like, I thought you guys had like 20 people on staff. And I'm like, no, we're pretty lean, but we have a lot of help. And I especially want to give a shout out to Joe Zamboni, who is our NEBDAC coordinator that Mike talked about, Diane Bruno, who has been assisting Sarah and the program director. And I need to give, he's on a work call right now, but my husband, Michael, who goes above and beyond with doing so many things and not asking for anything in terms of the graphics, the photography, and so many other things. And for those else that are subcontractors, thank you for what you do, because you're part of the fabric, so to speak. You're the piece of the quilt that makes NEHA into who we are. But as we have questions, I also just wanted to take a moment just to thank our sponsors of FallFest. So this is part 2 of FallFest. This would not be possible, and usually our annual meeting is within FallFest, so we usually do this in the beginning and at the end. But it would be a missed opportunity to not say thank you. So our presenting sponsor, Genentech, who gave an incredible, powerful keynote presentation this past Saturday. Our champion sponsors, Bayer, BioMarin, CSL Behring, Hema Biologics, Novo Nordisk, Pfizer, Sanofi Genzyme, Spark Therapeutics, and Takeda. Our advocate sponsors, Accredo, the Boston Hemophilia Center, Cottrell's Pharmacy, Grifols, the Hemophilia Federation of America, My Life Specialty Pharmacy, Octapharma, Optum, Paragon Healthcare, and Sigalon Therapeutics. And then our activity sponsor, Medexus Pharma. Fall Fest and our education, you saw where we spend our dollars, and it goes back to education. It would not be possible if it wasn't for these companies that have been listed on this page here. So I'm going to stop sharing my screen there, and we'll wait for questions to come in. I will just preview as well. Part 3 is Saturday, so Fall Fest is not over yet. It's like the song that doesn't end, that keeps going on and on, my friend. Saturday is the last part of Fall Fest. It's from 9 until 11:30, and I know he's going to do this without me even asking. Brandon will put in the chat the link for that. Now, I know it's a little confusing. You register via Eventbrite for the in-person, but we're just asking you, it takes about 3 seconds to just fill out your name to get into the Zoom account. But we're going to have 3 sets of breakout sessions and then 3 sets of breakout sessions. We're going to have some fun commercial breaks in between. And then we have our NEBDAC update that you'll see individuals like Mike, our state lead, Joe will be giving a national and local update. So I went over briefly what's happened, but a lot of work has gone over the past year in terms of advocacy outside of other things that I've mentioned. So that's this Saturday, 9 to 11:30. You could be on your phone, you could be anywhere. Then I also wanted to just mention one other thing too. We talked about this on Saturday. If you attended the in-person event up in New Hampshire and you attend all 3 sessions, you do have access to a reimbursement of up to $150 for your hotel cost or Airbnb or camping, whatever it was that was part of the registration, and assistance to gas. So all we ask is that you attend the in-person, you attend tonight and attend Saturday morning, and then we will have the form and the survey to upload all that, and we will send the check out once you complete all that there. Because again, we don't want the financial reasons to stop you from attending these events. And who knew it was going to be peak time in North Conway, New Hampshire? It was the busiest weekend of the year that we picked, but it was beautiful with the colors. And then let me see, a question did come in privately, Nancy, that I'm going to spotlight you. And this is about the strategic plan. Are the yearly strategic plan breakdowns available on the strategic plan website as well, or will those be available at a later time?
Right now, we have just the adoption of the 8 strategic priorities on a document. It's more like a Word document. But we do have a spreadsheet that breaks down how we're going to try to get to those. And I guess we could share them probably during the course of the year. It's very detailed and we thought very overwhelming. It has action items, measures of success, point people, dates, and all kinds of other details on it. So I suspect we could simplify it and put it on there as well if people were really interested. We weren't really sure how much people really wanted to see, honestly, and didn't want to make it unpalatable for people. So I would be happy to share it. I mean, it's just a lot. Maybe we can do a Reader's Digest version of that as well.
Thank you, Nancy.
Does that answer the question? Yeah.
Let's see if they ask any additional questions, but you could totally send private messages like this one if you don't want to ask them inside. We will not read your name for privacy purposes if you want to send them privately there. Awesome. Another question did come in, which is a good question. And Kate, can I turn this over to you? Why did NEHA move the walk back to October again for next year?
Yes. So we pushed the walk back because really it's hard to ask people twice in 1 year. So we had it in October this year, and we were concerned that if we had it in June next year, that we would really only have 6 months between now and then. And that really isn't enough time for all of us who lean hard on our friends and our family to give to really make that ask in only 6 months. We felt like we really needed a full year to give them a break before we asked again.
And also, I would like to add to that looking at the balance of the schedule throughout the year, it wasn't a terrible thing to not have the walk followed right by camp. That's a lot for the staff. So it seemed like those are 2 really big programs or two things that the staff work really hard on, and so it was a good thing to kind of separate them a little bit more. So it seemed like it worked staffing wise as well. So.
And the weather.
The weather is
yeah.
lovely at the first, next year it'll be October 1st, and hopefully we'll get another beautiful day like we did this year.
Absolutely. Great. Thank you both. All right. Another question. I see a private one and then one in the chat. So let's answer the one in the chat. Jean, thank you for becoming a member. We are so excited that you are officially a member of NEHA. How can you get more involved? Excellent question. And if anyone, staff or board, please just jump in here as well. I would say that by getting involved is a multifaceted approach. Number one, attending the events. And we're really hopeful to have more events back in person next year, even though they will look different from what 2019 will look like. We will definitely be doing more events in person. However, what COVID has showed us is that virtual events allow us to do things like this without having to drive 3-4 hours, get a hotel, have your kids go, etc. So there will continue to be a virtual component of not as much as we did last year, but definitely the virtual component. I will say at our Hispanic Heritage Symposium, which was in person at a hotel, we piped in a physician from Puerto Rico. And we had help, Manny Lopez, thank you for helping with this, but it was incredible to have the Zoom account be hooked up to have her be piped in and then have her on the screen, and it totally worked without us having to go crazy with technology. So I think that there are ways. Another way is volunteering. There are so many committees that we have for the programs. Programs committee is going to launch. We have our advocacy committee that Mike mentioned, where we are still in need of state leads and our ambassadors. We have our development committee, our mental health task force, our DEI. I think that there are so many ways that if there's a specific area that you're interested in, more than likely NEHA has something for you. And if we don't, there's always that bucket list of ideas. And then I would say the third aspect of getting involved is, I think sometimes maybe asking questions. I think asking questions is the best way to understand. If you heard something tonight and you're not sure what that meant, we can absolutely peer you up with another parent, another individual, or as a staff do a one-on-one with you to help get you acclimated to the community itself. So hopefully that answered your questions. If not, please put them in the chat, but let me turn it over to any board members or staff to help answer anything else.
I was just going to say that I'm putting in the chat a link to the volunteer form that we have on the website, that we often will get people who want to just look at, send us a message and fill out the form, that their name and their contact information and what committee they might be interested in working on. So I was going to put that in here, but I'm not as fast as Brandon. This is not very good at this. Volunteer questionnaire.
If not, he'll get it up. I have no doubt.
I probably won't spell questionnaire right, but there we go.
That's okay. Awesome. Thank you, Nancy. That's great. And that's also something that's really good too, in terms of making sure that if you do have specific ideas, by all means, fill out that questionnaire and that can help. All right. Anything else, Nancy, about that?
No, there was one question that I got private message that maybe you can help me answer, about staff salaries and the overall budget breakdown, the pie chart you showed. I think it's more complicated than where your salaries get broken down to. Am I correct?
Yeah, I can answer that. And thanks for asking the question. So what we do is staff fills out a timesheet every 2 weeks. So we're paid bi-weekly. And based upon the auditor's feedback, hours get classified by the following: general, which is administrative, so that's general office hours; fundraising, education, support, and advocacy. So once those hours are filled up, and now actually we do them virtually, not virtually, we do them into a cloud-based system, because up until early this year, we had binders and binders full of these pages that we would have to then show the auditors at the end of the year. Those then are taken into account when we show the education, support, and advocacy as well, because these programs can't lead themselves. The talent that goes behind the programs is what's making the magic happen behind. So a nonprofit is absolutely able to showcase the hours based on the mission of the organization. So when I showed that pie chart of the percentages of education, that includes the percentage of hours that are based in a calendar year to the main themes of our organization, which is education, support, advocacy, general, and then fundraising. So what the auditors will do is they'll sit down with myself and Bill and ask questions about this. But that's how we also showcase too how 86 cents of every dollar goes back to support the organization based upon our mission. So really nonprofits are able to showcase that depending on what their mission is. And that's why I am so glad. I know some organizations dread audits. I actually enjoy it because we grow. We are not a perfect organization, nor do we want to be a perfect organization. And the audit's not meant to hurt us. It's meant to help us. So I learn something every year when we go through it. And as I mentioned, we're going to be wrapping up soon. So hopefully that answers the question. If you need more clarification on that, also our 990 is available. We're going to be working to make them available, not just through GuideStar, but hopefully having them available on the website as well. And you as a community member, as a nonprofit, are more than welcome to look at that 990 or ask any questions. We are not hiding anything here. We are helpful to, more than willing to have you walk through anything that's in that. All right, the next question that we have is Nancy or Carolyn, I'm going to turn this over to you. Will the advisory council consist of a diverse group of individuals such as grandparents, siblings, etc., or just more directly affected community members? So let me spotlight you, Carolyn and Nancy.
Yeah, so we want the advisory council to include as diverse of a group as possible. We're really interested in making sure that we hear the ideas of all community members, regardless of their connection to the bleeding disorders community. And the hope is that we will get individuals who are interested from even the teen groups up to grandparents as suggested. But yeah, that's really important to us to get as wide and diverse a membership as possible.
Great.
I agree. When are we going to have our first meeting, Carolyn?
Next month.
Yay, okay. Stay tuned, everybody.
Awesome.
We've been talking about this one for a while. We've just, all of a sudden COVID hit and the world was upside down. So we had to rejigger our priorities, but I think we're able to handle it now, don't you think? Yes. Thanks to Carolyn.
Awesome. Thank you both. All right, a couple more questions that came in. Just let me look at the chat here. I love the questions. Keep them coming. I feel like I'm the pitcher in the Red Sox getting the hit, hopefully a couple of home runs here, if not too soon, or hopefully not too soon. The next question is, when do you expect the niche community member-led programming to be up and running so that people can request NIHA support for events like fundraisers or programs? Kate, is that something I could turn over to you, or which other board member?
I'm happy to speak to it, but I also don't want to jump in front of you, Rich, because I'm not quite I'm not entirely sure of the answer. Yeah. Maybe ask Brendan as well. So this is a program we have the outline of the program established, and a draft application has already been done and tested. We've piloted the program, but we plan on distributing it widely very soon. Rich, is that?
Yes. Yeah. So I will say that Kate was the first one to try it out. Kate put a request in for a newer diagnosed initiative where there was dinner and then ice cream, and then, a rap session, community-led peer-to-peer education. So we worked out the kinks with one. It is live on our website. So the do-it-yourself fundraiser is live. The do-it-yourself program is not yet. So there really is going to be a difference of if you have an idea for a fundraiser or a program, there's going to be two forms to fill out. Actually, Kate, remind me, did you fill out the fundraiser or the program one? The program one.
I've actually done both.
Okay, so
but the on the website, the only one that's currently available on the website is the fundraiser. I know we have the draft application for the community-driven events program, but I don't think that we have made that public yet.
Not yet, but I think a goal would be in the beginning of the year, we will have that available. So if you have an idea of getting together, you propose it, send it through the form. A NEHA staff member will work with you. You need collateral, pens, stickers. You set the budget, so for what it is, and then we will work within our own budget to say, how do we make this possible? And then what we did in Kate's situation is if a person can afford the cost of it, we will then, just like we do with a staff member or board member, reimburse based upon the proper documentations for the receipts and everything else after that. So it's a new program that we're hoping for both fundraisers and programs. And I just looked at, thank you, Brandon, for the community fundraiser page, because I know the program came in for that, but it wasn't directly through this site here. So stay tuned on that, but really great question about that there.
And I'd just like to add one of the caveats to it is that the community-driven events do need to be open to the entire NEHA community. So even though an individual is running it, you just have to think of yourself as kind of like the representative of the NEHA staff who's organizing the event, but it has to be available to anyone who meets kind of the goals of the event.
Yeah, that's a great point, Kate. So the events will still be posted on our website. We will treat these, if you were part of the community in 2019, there was a lot of moms in action, dads in action, smaller paint nights, other events. Those are the types of things NEHA would promote, but it would just alleviate some of the pressure on our staff, as Kate mentioned, not to be at all the events, but they're led by you. And we will provide you with any documentation or support, phone calls, that is needed leading up to the event. But ultimately, we want to work with you to create what type of event works within the objective of what your vision is, essentially. I don't think anyone would want to put together a FallFest, a 3-day weekend at a hotel, but a dinner, a mini golf, a gathering at an ice cream shop, a movie night, anything like that. I think that's something NEHA can certainly help with.
I'm going to host another women's tea like the old days. We used to do that back when Matt was younger. We used to host those. Those were great.
Can men come or just women?
It's however you identify.
All right. Thank you, Nancy. Good answer.
I guess we could just call it a parents' tea to make it more equitable.
Thank you, Kate. Thank you, Nancy. All right. I have 2 more questions, and then we will see if there's anything else that came in. The next question is, should we expect to see many of the NEHA events moved around from their typical times because of COVID? Excellent question. What we have all learned as human beings living through a pandemic is life is different, period. And we are, just like any other organization, navigating what the return of normalcy looks like. Now, some of it is unknown because there's a lot of variables and other things that we don't know yet in terms of gathering in person versus virtual. But what we do know is it's given us an opportunity to really think outside the box. So I can say, when you look at the 2022 dates, number 1, Consumer Med is usually in March. It will be in April next year. FallFest is usually in October. We did move it to November because the walk is in October. The Red Tie Soiree in the past when we did the gala and the red tie was in November. It's going to be moved to May. So there's been some shifting. Camp will likely stay in June, the last full week of June. I know it's not ideal, but it's the best week at this moment that Geneva Point can give us. Then that leads us with all the other events, the retreats, Hispanic couples, women's, B leaders, etc. What I will say is those dates have not been solidified yet, but we are trying to think outside the box of, can we combine two? Can we still meet the objective and the mission of the retreats and maybe think outside the box where there's some peer-to-peer mentorship inside of there? And I think that that's something that where our minds are going. It's not 100% yet. But I know that that's something that will be considered. So unfortunately, too, I think we had a good rhythm down path where Consumer Med was either in Northern New England or Southern New England, and FallFest was the opposite. So it gave the opportunity for one of our big conferences a time to shine in one of the 3 Northern New England states and one of the 3 Southern New England states. I will say, and this is across the board due to COVID and the contracts that we still have that are pending, we're going to do the best we can to fit the space that we need. Some of the hotels that that we've used, the exhibit halls were on top of each other. People were really close together. So we're trying to be mindful that the hotels that we use going forward have enough of space. So we're playing that jigsaw game right now of, can we switch certain hotels with certain contracts? And then like we did at FallFest, it was amazing to be outside during FallFest. Thankfully, the weather was good, but who's to say the new families retreat and the teen retreat can't be together at Sherman Farm? So I think that we're trying to brainstorm some of how to do this. But if you have ideas, by all means, we are open ears and open eyes. And if you have any thoughts about this as well. I will say, for the cost associated with it, for anyone that has put events on, hotels are costly. Using something like a third-party vendor does decrease the cost as well and make it much more family friendly. So stay tuned on that. Excellent question. Don't have all the answers, but the ones that are on the website are at least solidified there.
And Rich, I'd love to jump in and just say that, as we make these various changes and we try new things in the wake of COVID, that's part of why we really want to have the board advisory council, and we want to be available as a board to get your feedback. And we will be reviewing all the feedback that you provide to us. But we know you all love to bombard Rich, but please know that we are available as well, and we'll be reviewing all of this, with the staff.
You would think I know how to unmute myself. And also, I apologize for the dinging. My computer is in the hospital right now, so I'm using my husband's, and I didn't know how to turn off the dinging. So he helps me with that. So there's going to be no more dinging of things on this computer. The last question, Nancy, I'm going to turn this over to you. The question is, what is the process for applying to the board, and when will that be open?
Oh, hold on, unmute myself. There we go. Yeah, so the process will be, Rich, on November 8th or thereabouts. I think we're going to open it up, and he will be sending out just an announcement that it's open, and you'll respond to board@nehemophilia.org, say you're interested, and then we'll send you an application package. So it should be November 8th through mid-December-ish. And then the goal is to bring on the new people we have a board meeting at the beginning of March, where we would bring on the new people by then. So we don't have a set number of what we're looking for. We know generally that we are looking to increase our kind of geographic and all types of diversity on our board, so that we're not purely people from Massachusetts. And we want to make sure that we're open to all 6 states, and but want to encourage everyone who is interested in applying.
Great answer, Nancy. So stay tuned for that email. That November is not that far away. It's only a couple of weeks away, which is crazy. Last question that I see that came in. I know we're running a little bit late, but these questions are awesome. So feel free to keep sending them in. The next question is, will NIHA resume Blood Brotherhood, moms, etc. next year in person? It's a great question. Moms in action, dads in action, blood brotherhood, blood sisterhood are so important. For those that were at in-person FallFest, the reason why we had the wrap sessions in person was based upon feedback. Is over Zoom, they're great, but there's nothing like being together in person around a table. I think this is where that community-driven program can really come in, that if you would like to help us with this and help run one of these, by all means, and if you have an idea, this is where they can. But we are committed to hosting the wrap sessions, hosting the community events around for moms, for dads, for blood brotherhoods, for blood sisters. And if there's overlap, I mean, sometimes we've had the blood brothers and the dads combine and do stuff together. So I think really the world is our oyster in terms of imagining what this could turn into in terms of that support. But no, we are definitely going to. And actually, we also have, Brandon, not to put you on the spot again, you're going across our website like a madman, but we do have a spot on our website now where you can actually fill out if you're interested in a certain, like a blood brother, moms in action. There it is, our community groups page. And this was based on community feedback from someone that's on this call that's like, hey, I can't really find moms in action, dads in action on our page. So Brandon built this great group page that you can now fill out, that if you find it on our website, it's another way for us to constantly update our database as well.
I honestly didn't know we had that.
Yeah,
so I just learned something myself tonight. Wow,
It's
that website, I tell you, it's becoming more robust every day. It's great.
For those that remember the old NIHA website.
Yeah.
That's all I'm gonna say.
Light years better.
It wasn't good. And Brandon,
Actually,
yeah.
piggybacking on the discussion on the website, I did just want to put a plug in for our mental health section. I know I talked about it before, but we also, when you go to it, a survey, a mental health survey should pop up. And I would just ask you to please take a moment to take that. It will help the mental health task force continue to meet the needs of the community, but it also asks for feedback on the website. So this is what we are thinking about as phase 1 of the mental health section of the website. And so your comments and feedback and what else you want on the website will help shape phases 2 and 3. So please check that out.
We did have, based on the email today, we had several people take the survey. So that's good. That is good. Thank you, Kate. All right, last question that came in here. Will NIHA be having their in-person holiday party this year? Great question. I do not want to say yes to that just yet. I will say that Sarah and I have a call with Alnoba, where we've held at this beautiful retreat center in Kensington, New Hampshire tomorrow. We are going to be brainstorming with them. How can we do some stuff outside? If we were to have it in person, masks would be mandatory like all of our other events. It may be limited, but we're really hoping that we could do a variation of the holiday party, since it's such a beautiful facility for those that have been there. And as of, we've been there for 3 years and there's never been snow on the ground the first Sunday of December, but we are hoping that we can do a variation of it in person, but stay tuned on that. If not, it will definitely be, we will be doing something on December 5th, period. I just don't want to commit just yet on exactly what it is, but more details to come, because December 5th is not that far away, which is crazy to hear. But with that said, I'll give one more pause. Is there any other questions? All right, well, you can always reach out to any of us. Again, I want to thank our staff. I want to thank the board. it is an honor and a privilege to be part of this organization that has so much heart, and that cares about everything that we do. We care about each other, and we are a Wicked Strong family. I know we've said it many times, but when you think about family, I think of each person on this call and those that can't attend it. So thank you all. Thank you, Nancy. Thank you to the board. And we look forward to seeing you on Saturday morning. But have a great night. Thank you.
Thanks, everyone.
Okay, say it again. Bye-bye.
Thank you.
Bye, Liam.
Bye, buddy.
Say have a good night. Have a good night.
Hi, Colby
Good
and
night.
Ellie. Hi, Liam.
Look at you guys.
Say night night. Night night.
Oh.
We miss you guys. Okay.
All right. Good night, guys.
Good
Take
night.
care.
Bye.
Bye.